I'm Dr. Laura Vowels. I'm a certified emotionally focused therapist. I did my couple and family therapy training in the US a few years ago, and my PhD in the UK at the University of Southampton. My research has been focusing largely on sexual desire and desire discrepancy in couples, but I've also done a lot of research into sort of attachment theory and how partners can support each other. I currently live in Switzerland, actually. I've been here for a couple of years doing a postdoctoral position, and I'm starting a new project looking at how we can use chatbots like ChatGPT for relationship advice and relationship interventions. So that's my kind of newest project where I'm going with. I also do see clients in private practice, have been doing so for 6 years, I guess, and continuing, but primarily I'm a researcher nowadays. Don't read very much outside of kind of academic literature, so my reading list currently consists primarily on research into chatbots. Outside of that, I currently read rom-coms in French. Since moving to Switzerland, I've had to learn French from zero, so I spend a lot of my time learning French through rom-coms. Works quite well, actually. Talking to a partner about sex is definitely the most important part of it. I get so many couples for sex therapy or for relationship therapy for that matter that have never spoken to their partner about sex. Somehow they manage to have it usually, but very rarely do they actually talk about it, and so they may not have any idea as to what the other person likes or how they would like to have sex, or whether they're still into the sex after 10 years. So kind of one really good way of improving your sex life is definitely to communicate and talk to your partner. It's really difficult if you're not used to it, and it can feel embarrassing and it can feel really, really vulnerable, but there isn't really anything better than that. I think one thing that obviously has changed over the years is that we expect more and more from our romantic relationships. So obviously back in decades, kind of hundreds of years ago, it was mostly just a business arrangement. Being in a relationship, it was just to bear children, increase your empire, your wealth, but not really looking for love or some kind of fulfillment. And obviously nowadays we want love, we want sexual satisfaction, we want our partner to make us better versions of ourselves and to support ourselves in our dreams and goals. And that's quite a lot to put on one person. So I think we have this kind of microcosmos where we just become the two of us, whereas before we would have a village, or we'd expect one thing from our partners, and then we'd have friendships elsewhere, we'd have bigger families to kind of gain that support from. So now we're kind of in this one-to-one. Certainly this was the case massively during COVID. And I feel like now, after COVID, people are still a little bit hesitant to kind of re-engage with society. Maybe they don't quite know how to. Maybe they've gotten kind of out of touch with friends that they didn't see for years. So that circle just becomes closer and closer, and the pressure kind of on the dyad becomes greater. In my presentation, we're going to be focusing primarily on sexual desire discrepancy in couples, and how to kind of understand where it comes from. We talk about the sexual cycle that couples get into, the kind of pursue withdrawal, which often leads to sexual desire discrepancy, or what I would call perceived sexual desire discrepancy, because oftentimes when you talk to couples, they actually want similar amounts of sex. It's just that because they're in this cycle, one person started avoiding and the other person started kind of pushing or wishing that the couple were having more sex. So we're going to be talking about the sexual cycle, and then some things, kind of recent, different therapeutic modalities, different interventions that we can use to help couples overcome desire discrepancy. So I think so the different takeaways that I would like for people to get include being able to understand that sexual desire discrepancy is kind of a natural part of most relationships. It occurs at some points in most relationships, but obviously if it becomes chronic, if it continues over time, if there's always one person that wants more sex and the other person that's withdrawing and pulling away, that's often where the problems arise. And if we're not talking about it, we usually can't overcome it either. And then, we'll talk about some of the treatment options, things that we can do with our couples and our clients. We don't spend enough time thinking about desire discrepancy. We tend to think about it kind of as the low desire partner, who's the problem, who needs to be fixed, rather than thinking about it as kind of a couple problem, something that both partners are working with. Because we have one partner that wants more sex and the other partner that wants less sex, but it's not that the low desire partner is ultimately the problem. There's usually something either within the relationship, maybe the sex isn't that good, or the situation around the couple is not going very well, or maybe the high desire partner has unusually high level of desire that they're maybe compensating for some other reasons. So what I would like us to do is to have more of a discussion around how we can help the couple navigate the desire discrepancy, and really try and understand where that desire discrepancy might be coming from, rather than just trying to treat the low desire partner. So that's kind of what I'm hoping to start the discussion on, and to think about and look at the treatments more for.